So winters are on and the chill is in the air. Hi, I'm Preetika Rao. I'm an actor from India and it's the right time to speak about winter tips and winter care. So today I have with me my dermatologist Dr Sharmila Nayak, who's a celebrity dermatologist and has been in this profession since many years. She has valuable information to give you. So stay tuned. Hello, Dr. Sharmila. Thank you so much for being on my show. Once again, it's winter time and I need some winter care tips from you.
Hi Preetika. So yes, winter is in the air and it's such a lovely weather and such a good time to enjoy with our friends, family. Now with winter coming in, you see dryness of lips, dryness of skin. You also start seeing that your feet start getting cracked, your hands and legs in particular start looking as if they're not your own skin.
Absolutely. Yes. I have been since many years using a very mild anti-aging cream only on the laugh lines because we keep smiling and laughing and expressions all day. So I feel that that's the best way to prevent, and I do it only specifically during winters. I don't do it otherwise. Maybe other times I would use just maybe moisturizer or something mild, but would that be a right thing to do?
Well, when we are looking at the change in weather, what is very important for everyone to know that if your skin is not extremely dry, so it goes through changes as the weather changes. It might be a oily or a normal to combination skin. So your products also sometimes need to change with the change in the temperature and weather. So when in particular you have a skin which is normal to combination skin, maybe sometimes acne prone, but with slight areas of dryness, then in summer you're using lighter moisturizers, water-based moisturizers. In winter, then it's time for you to change your product into a little bit more hydrating products. Okay. Some people have a little thinner and sensitive skin. Around the eyes, around the mouth, you might feel that the skin gets a little stretched, or you feel that if you don't take care, there might be a fine line developing. So you could put on your anti-aging cream, you could put on a little moisturizer. Now, very important tip, if your anti-aging cream has retinol, which is drying your skin, please apply the cream and then yes, you could always seal it with a little moisturizer. Extremely dry skin, you could put a hyaluronic serum, let it get absorbed, put your retinol anti-aging cream, and again after 5 to 10 minutes or half an hour, put on your ceramide based moisturizer. That's such an excellent way to take care of your skin, not only in winter, but whenever you think it's necessary for your skin to get hydrated.
So I saw this one article which said that petroleum jelly is not a chemical that we should be using on our face. Would you agree with that?
Petroleum jelly is an occlusant. So it occludes the moisturizing ingredients. So when you put a petroleum jelly on the face, it's not hydrating it per se, it's occluding the moisture. So I love to tell my clients to use a petroleum jelly, especially on the lips where we have less oil glands. Another trick which I follow and I've seen great results is just put your lip balm or chapstick and in the night, if you are prone to dry chapped lips, on top of that you put your petroleum jelly and you see it just pushes the moisture in. Okay. Same is true with oils. People say, oh, I'm applying oil on my hands and body, but I don't see or I don't feel it's hydrating enough. Oil is a molecule which does not go deep into the skin. Again, it forms a barrier. Okay. Put your moisturizer and then if you just want to take a little essential oil and dab it on top of this, see how great the results would be.
Okay. Also, can petroleum jelly be applied on the neck?
Again, I don't see it giving any benefits per se because again it's an occlusant. So make sure that you put on good ceramide based moisturizers or products which are probably helping the neck area per se. Like how you have specific creams for under eye, you could even use specific creams for the neck.
Okay, so using creams with retinol is absolutely safe.
Yes, it is safe, and nowadays we have retinols which are non-irritant. Plant-based retinol is a big thing now, and especially for people with sensitive skin, where they say, you know what, the gold standard for anti-aging has always been and will always be retinols or retinoids. But people who can't tolerate retinols or retinoids, then we have gentler ones which are plant-based extracts, and they work wonderful. It's actually called bakuchiol.
Okay.
So that's an extract which would probably help for people who have sensitive skin.
Okay. So is it fine to take these vitamin E oil capsules that we have, we get in India? Is it okay to cut those capsules and to take the oil and apply that oil, the vitamin E oil, under your eyes and maybe on the lips?
Right. So vitamin E, of course, I would first say that if you have an intake that helps you, and it has multiple benefits. But yes, I have personally seen some of my clients using it. It does not cause any irritation. It just starts hydrating. It has a calming and soothing property. So yes, you could use it. Just take a wee bit and just dab it with your ring finger, and it would help, because it is again very oil-based product. So yes, some people do it, and there's no harm in doing that.
Right, but no oil massages on the face.
No, not at all, because then it's going to clog the pores. Why would you put oil on the face? Because it's one, as I said, it's an occlusant. Like it's not a humectant. Humectant is something which draws the moisture.
Okay.
So it's not hydrating, it's occluding. So I wouldn't advocate that.
Okay, let's talk about your hands and your feet, especially your soles. Your hands start becoming dry, and they get more like wrinkled up. Your soles start cracking up. So what products would you suggest us to use during winters?
So the first important tip is, when we talk about face and neck, we also talk about hands. So we should always remember our hands are washed multiple times during the day. Nowadays, we also keep sanitizing our hands, so it becomes dry, not only in this weather, even otherwise. So what is one simple trick which I teach all my clients is, just keep a nice good hand cream or a moisturizer wherever you wash your hands often. So just make sure you're washing your hands, you pat it dry, and the next step is so easy. 1 second it would take just to slather that moisturizing cream on your hands. At night, especially when we talk about dry feet, dry hands, cracked feet, this is the season where you see cracked feet are very, very common. So you need rich moisturizing creams which would probably have squalene, urea. Some creams also have an element of alpha hydroxy or glycolic acids, so which helps in penetrating better, and it also helps in gently removing that top dead layer which has formed around those cracked feet. So yes, use rich hand creams, rich feet creams. And there are certain products which are specially designed with very rich hydrating ingredients for these areas.
Can oils be used?
Yes, when I talk about coconut oil, the trick which is very important to follow is just apply it maybe 5 minutes prior to your shower. Of course, don't put it on the soles, you might slip, but make sure you put it on your hands and legs. And what it does, it helps in protecting your skin, because when you are using your body washes or soaps, the essential oils which are there on our skin, it doesn't strip that away. Especially very useful for dry skin.
But you can use it at night, bedtime, when you're like just about to sleep. You can apply it on your feet, on your soles and your hands.
Probably just put your moisturizer and then take very little of it and just dab it on top of it to protect the barrier function, to occlude that nice layer of moisturizer that you have applied. Yes, you could use, and coconut oil I feel is by far the best.
I wanted to ask you about creams. So the concept of creams is pretty new age, because earlier, like if you go back in time, the creams never existed, So are creams really safe? Like, do they have ingredients that are like dermatologically tested and are like very safe
Yes, if you look at the prescription medicines or in general, if you look at hydrating, moisturizing creams and lotions, they are safe because they don't have any elements of fragrance, unless you choose something very fancy, like, you know, something which has a strawberry or some flavor which is not naturally derived. Scented hand creams. So go in for protective hand creams, hand lotions. You also get very good prescription ones which are available at any chemist shop. So just, and best thing, you know, Preetika, if you want to know which is a good hand or body moisturizer, choose the one which is for sensitive or eczema prone skin. They just don't have any chemicals, because imagine there's a cut on that skin because of eczema or dermatitis, and if you put something which has even the least amount of chemical, it might go and start irritating. So they are repairing the skin, they're calming the skin, they're protecting the skin.
Wow. Okay. So moisturizers and creams which are formulated for eczema and
or very sensitive skin.
Or very sensitive
Yes.
skin. Wow,
Yes.
that's a lovely tip. And with that, we end this episode. And if you have any questions, please write to us. I'll ask Dr. Sharmila. I'll answer these questions for you, especially in the comments. Lots of love.